Okay. Can you just introduce yourself?
My name is Melissa.
And Melissa, can you tell me what you're doing here?
I decided to try this form of therapy because after 3 years of being sick, I was diagnosed with a degenerative arthritis contributed by an autoimmune condition. I'd also had problems with a nerve entrapment and had gotten to the point where nobody could do anything, and I was constantly in and out of hospital, and so we decided to try this to see if we could get some results.
Okay, so basically when you come here you have a severe neck pain.
Yes, and I was struggling to walk, I wasn't working, I couldn't exercise.
So how was your pain out of 10? How bad was it?
Oh, probably about a 9.
9 out of 10.
Yeah.
And was it occasional or was continuous?
No, it was continuous, but it used to get worse at night. So I was also only sleeping maybe 2 to 3 hours a night.
So that's how bad it was. And tell a little bit about the journey with this pain. So how it started, how bad did you try to see medical help before?
I've been to various rheumatologists. I've tried everything from acupuncture to miracle therapies that you can buy on the internet, tablets, vitamins, you name it, I've tried it.
So you see some neurosurgeons?
Yeah, I also saw a neurosurgeon.
So what medical professional told you?
Well, with the nerve entrapment that I would have it for the rest of my life, I was getting the nerve ablation done every 3 months. And obviously with the public health system, it would be delayed, so I would only get it every couple of months, but in that time that I would be on the waiting list, it would get worse.
And basically, did you get much help out of this treatment?
Well, once I did, it was okay, but it would only last like 2.5 months, and then I'd have to go back into hospital and have it done again.
So that's basically a surgery?
Yes.
And after that it all will come back?
And then it would come back, and once it came back it would make everything else worse as well, so all my joints would flare up, I was tired.
And did surgeon say that this treatment would actually fix your problem, or it was
No, it would just maintain it, and every time I had the procedure I also ran the risk that it could go wrong, so the nerve could become damaged, I could be in worse pain than I was in, so they always made me sign a disclosure form before surgery.
But because you've been in so much pain, you have no other option.
I had no other choice.
So how did you find about ozone therapy and my method?
Well, my fiance actually found it on the internet, and the day that I came in was actually the day that my surgery, they had cancelled on me, and told me that they wouldn't be able to do the surgery for at least another 2 months, and I was desperate because I was already getting to the point where I'd been to hospital twice the week before.
From pain?
From pain.
That's how bad it was.
And when you go to emergency for pain, they just give you more painkillers and send you home because it's considered to them as chronic pain and they can't do anything.
And I remember you came with a walking stick, it was really bad. Okay, so when you came here, tell me honestly, what was your expectation? Did you expect much?
The issue was that because I had tried so many things before, I admit I was a little bit cautious, I wasn't sure how it was going to work. I did try and hold some hope.
But you was quite skeptical.
Yes.
Honestly.
Yeah, I was skeptical because we'd already spent so much money on so many other things that I wasn't sure if it was actually going to work.
Well, so tell how was the result of the treatment?
From the first treatment, the nerve pain was gone. So I no longer had any pain in my nerve. I do have some damage in my sacroiliac joints, and now it's been 4 or 5 treatments, and even that's nearly gone as well. So I'm walking, I'm exercising, I can do the shopping, I can clean up and do things at home that I couldn't do before. And I'm working.
So has this treatment brought you not only just pain relief, but brought your lifestyle?
Yeah, everything's pretty much back to normal. So I'm getting back to work part-time. And
so how much pain do you have now out of 10?
Nothing.
It's a
0.
0 out of 10.
Yeah.
And can you walk now normally?
Yeah.
You
I
don't need
can
any
walk.
more walking sticks?
No walking stick. I'm planning to throw it into the barbecue and burn it.
So does it change your situation with your family, with your plans?
With everyone. Everyone can't believe it. They're just in so much shock, from my fiance to my family, my grandparents. You know, from one treatment from a week where I couldn't walk, and then all of a sudden I was walking normally without any assistance.
So basically now you're having your life back.
Yes.
And now you believe it's gonna work?
Yeah, yeah.
And can you walk now so we can
yeah.
see? So you can walk, see, no sticks, you can walk.
And I can...
Still move, so.
And I can now lift my legs, which I wasn't able to do at all before.
Oh, wonderful. Well, thank you so much. So do you think this treatment would be good, beneficial for other people?
Yeah, I really highly recommend it.
Okay, thank you so much for sharing.